I can remember when I was coming to DTU for the very first time, I was filled with trepidation and anxiety. I think it's fear of the unknown. But what I will say is, from the minute I walked in the door, I felt safe, I felt welcomed, and I felt reassured.
Coming into the day treatment unit for the first time as a patient, I found it quite daunting initially, almost scary, but over time, I found it quite a safe and comforting space.
If you're an individual coming in on your own, I wouldn't drive. I would get a relative or a friend to bring you in, because people assume that, oh, well, I won't be tired, I've had all day resting, but the drugs going into your system will have an impact on your ability to get to and fro, in a sense.
Your appointment time will often stay the same time approximately while you're coming for the whole of your treatment. So if you're coming for 6 visits to us, we tend to know how long the treatment's going to be. So we either book you for 10 o'clock because it's going to be 6 hours in the department. However, if your treatment only takes an hour to be delivered, we might book you for 3 or 4 o'clock.
We'll check your medication history when you come in. So it's a good idea to bring in a little list if you can. And we just need to check that any regular medicines that you may be on are safe to take alongside the anti-cancer drugs and other supportive medicines.
When you arrive at the day treatment unit, you normally go to the reception desk and you'll be met by either one of the nurses or the receptionist, always with a smile. You'll then be allocated either a bed or a chair, depending on, for my point of view, what I'm having done that day.
Initially, when you check in, you'll check in at the desk and we will check your identity, and we'll also check your weight when you arrive, because we need a weight each time just to check for any weight loss and also that the dose of the drug is going to be correct.
I will show you to your chair or your bed depending on your treatment, give you a quick tour of the unit, show you where all the important things are, the toilets and the coffee machine, and put a wristband on your wrist which will identify you and help to make sure that you receive the correct treatment.
If you come for a first treatment to the department and you've never had this drug before that the doctor has prescribed for you, so we would suggest you lie on a bed while you're having that. The second time you come, if you've been fine, which most people would be fine, you can sit on a chair.
The nurse looking after you that day will always go through what we call a new patient talk. So they will take some time to sit down with you on the day of your treatment and go through everything that you will need to know to go home with, particularly things to look out for whilst you're at home, including risk of infection and things that you might need to ring the triage number for. But you'll have the pack to go home with to refer back to later. Once you're then in a chair, the nurse looking after you will always check your blood test results that you'll have had done most recently to check that they're in the correct parameters and that it's safe to give you treatment that day according to those blood results. We will always do a pre-assessment, so just running through some questions to see how well you've been over the last few days prior to starting your treatment. And occasionally, depending on the treatment, we may do a set of observations, so blood pressure, temperature, pulse check.
Some people will have what we call a cannula, so that's a little needle that will be inserted normally into the lower arm, so the forearm or the back of the hand, and that will be temporary. That's only just whilst you're having your treatment, and that will be put in every time that you come for treatment. Sometimes people have a more permanent line, something like a PICC line or a Hickman line, and very occasionally something called a portacath. That will stay in for the duration of your treatment. We will decide which access that you get depending on the drugs that you receive and how easy it is to access your veins.
If you have a cannula in, they will generally do the cannula from here downwards. So if you do want to wear a long sleeve shirt, just as long as it's loose fitting so it can be rolled up.
For me personally, I need to have a cannula put in every time, but it only takes a second, and it's a case of just waiting until your infusion's ready. It's always checked by 2 nurses.
The nurse will be looking after you. They'll always introduce themselves at the beginning of your treatment, so you can just flag them down, or you can ask any of the other nurses or members of staff.
When you're having your treatment, you are attached to an IV machine, but the machine is on wheels, so you can move it around. And I found initially I was really worried about moving around, and I was really worried about the IV pulling up or pulling off, or it causing pain and discomfort. But Once you've done it, it's kind of like riding a bike. You get used to it and you know what you can and can't do, and you eventually get to a point where you're almost surfing it around because you get more confident and comfortable with it.
The drip machines can beep quite regularly, and it's quite a loud, high-pitched noise, which can be quite alarming until you get used to it in a big, busy room with lots of alarms going off.
We will hear the pump going, and we will come over and we will sort it. But don't worry about it, don't panic. It is quite normal, and it does happen.
There are toilets around, you are able to walk around, there's a lot of space to walk around or maneuver around. There is a tea and coffee station with some treats. You're not stuck in one place for the amount of time that it takes for the chemo to go in.
It's fine to move around the unit. We just ask that you wear your shoes. If you don't want to wear your shoes, then we do have some socks that we can give to you. I've got kind of like grip, they're like non-slip socks.
What I did do was take some snacks with me to keep me fed through the day, but also I took books, playlists of music to listen to, things to do. So when I didn't feel like talking to someone on a day when I didn't feel like being social, I could just keep it to myself and occupy myself.
The one thing I would say that is a massive help is they have got a really good Wi-Fi service. So I took my iPad and I was able to sit and watch Netflix.
If you do bring an iPad, just bring the headphones with you if you're watching something.
The atmosphere in day treatment unit is so friendly, so warm, so welcoming. To say it's a bit like a social club sounds a silly thing to say, but it is. There's a camaraderie between you all, and it's so nice to see the same people time and time again, and find out a bit about them and how they've been, as well as telling them how you've been.
You obviously get like a hospital bell alarm system, which they respond to pretty much straight away. I don't think I've ever been left waiting. They have doctors there that if you have any concerns that you can see. If you have any sort of side effects to the drugs, that person's on hand straight away to sort of try and help sort it out. You have specialist nurses, you obviously have sort of normal nurses there, and everyone will make time for you.
If you're experiencing side effects, I would definitely recommend that you let someone know on DTU, whether it's the nurse or the doctor or the pharmacist. There's often something that we can do to help, so it's always important to tell us if you are experiencing any side effects.
If I've got a problem or a question for anybody, it's never an issue to ask. No question is deemed a silly question. You're always given time to ask questions, and if it can't be dealt with at that moment, they will find somebody who can answer it for you.
If anybody does need to speak to a nurse or a doctor, or feel that they want to speak to a doctor or nurse in a bit more of a private situation, we are able to accommodate that. So we do have a doctor's office that isn't in permanent use that we can take people to.
There are private rooms where you could have a private consultation with either a nurse or a doctor or the pharmacist, or if you need to speak to someone with help, if you're struggling emotionally or with any other stresses or anxiety.
If you're on injectable anti-cancer medication on DTU, then you'll likely also be on some other medicines that you'll need to take home as well. Typical things that you might get would be anti-infectives, so you might be on things that will help prevent infections. This is because potentially due to the treatment that you're on, you may be more prone to getting an infection. You also may be on anti-sickness medicines just to prevent nausea and vomiting and help with these symptoms. And there are a number of other supportive medicines that you may be on, but we can discuss that fully or more fully when you come on to DTU.
We'll see a pharmacist at every session. The pharmacist will explain the drugs to you, explain what they're for. I was given a checklist so that I could keep track of which drugs or medications I would be taking, and that I could make sure that I didn't forget any of them, because sometimes it does seem overwhelming, and it is quite common to forget what you have done or what you need to do. So you're given the drugs, you're explained the drugs, and the pharmacist also checks for side effects, explains when to take the drugs, around food, before food, etc. And they also discuss any problems that you might be having with any of the drugs.
Chemo does bring your immune system down, which is quite daunting and scary, but you get given a number for a triage unit. I phoned them straight away with my concerns. They would then speak to doctors, they would get doctors to phone me back so you weren't left sat on the phone for ages. They would then tell you what to do, whether you were to come in, whether you were to wait a little longer. You know, that after they'd done the medical sort of questionnaire bit, they would have sort of just what was needing to be done. Definitely give them a call because that's what they're there for.
Triage is a unit based upstairs in this hospital. They are a dedicated, urgent unit for all of our oncology and haematology patients. So anyone that would ring triage, it's basically a fast track to getting specialised cancer treatments, be that haematology or oncology. And they always have a doctor available. The number is 24 hours a day, and the nurses that man that number do go through a full assessment, and they have different sort of protocols and algorithms to follow to getting you the right treatment depending on what they think might be wrong with you. And if necessary, if you need treatment at any time of day or night, they'll be able to get you down the right channel to getting treatment as fast as possible.
You don't know how your body's going to respond to the drugs. So if they say to you, oh, you're going to be here 5 hours, I would say estimate 6, so that at least that way, you know, if you're out in 5, brilliant. If it's up till 6, then, you know, at least you're prepared for that.
I think allow a few hours on the day of your treatment. You know, factor in that you might have to wait a while before you're seen, then you've actually got your treatment, which can take a few hours, and then you may well be asked to stay afterwards.
We want everybody, as much as possible, to feel that we care individually about you and that the experience that you have coming to our department is the best that it can possibly be. We always want to hear from you if you have anything that you're not happy with, or that you either want to make a complaint about, or just generally tell us about something that you'd like to be done differently the next time. We're more than delighted to hear that, because it really helps us. We really want you to feel that you've been looked after very specially. We want you to feel that it's a friendly atmosphere and that you don't mind coming each time.